On this Saturday night, rapid testing for COVID-19. The need for speed as the vicious virus mutates.
I'm worried that the UK variant is much more widespread.
A made-in-Canada solution given a second chance. The uproar in Russia over the detention of Vladimir Putin's enemy, remembering the king of talk.
Got a date with an angel.
And his most memorable interviews. Plus the treasure found at a thrift store.
Holy smokes. This is a lot of money.
And the employees who did the right thing.
Global National with Robin Gill.
Good evening and thank you for joining us. We begin tonight with some positive news in the fight against COVID-19. An Ottawa-made rapid test has finally been approved for use. The Spartan Cube promises to deliver results in less than an hour. It was touted as a game changer at the beginning of the pandemic, but there was a problem and it took months to meet Health Canada standards. As Abigail Bimman reports, it's one tool to fight what remains a major health crisis.
It has the enzymes needed.
Redesigning the reagent testing solution took Spartan Bioscience longer than it hoped. Now it can be kept at room temperature instead of frozen, so it can be used anywhere.
Rapid point-of-care, easy-use diagnostics for COVID-19 will really alleviate the spread of COVID-19 more than a central lab can do for a lot of situations.
Health Canada has given the Spartan Cube the green light. The company says in large part because of a different, easier fix. The original problem was only with their proprietary testing swabs.
We were using our existing swab that was made to swab a cheek swab. It wasn't made to swab your nose and the back of your throat to get RNA or to get virus particles on it.
So Spartan simply switched out the swab for a regular nasopharyngeal swab already on the market. It says it will start shipping out back orders to the federal government this coming week and provinces which ordered directly within a month. A separate hopeful pandemic sign, a drop in new COVID-19 cases nationally.
We can breathe a brief sigh of relief. We are seeing numbers drop significantly in certain areas like Alberta and like Quebec. We're seeing numbers come down a bit in British Columbia and Ontario.
Biostatistician Ryan Imgrund says that doesn't mean we can relax, especially when we don't know how widespread the UK variant is.
I know this may come as a worry. It's our first exposure to this variant.
Friday, Nova Scotia recorded its first case and one of the South African variant. Lab testing now confirming people who had it in December, while in Ontario.
We're in a deepening crisis. We have a resident die in long-term care every hour now.
My hospital has been, what we consider ground zero for COVID in Ontario. For actually a few months, we have been at capacity in terms of our COVID wards, our medicine wards, as well as our ICU. And particularly a few weeks ago, we were transferring significant number of patients.
Emergency room Dr. Lisa Solomon is now cautiously optimistic.
Probably the first time in a long time that I had a shift with no resuscitations and no really critically ill patients.
Solomon says things may be plateauing after a big post-Christmas spike, but no one should let their guard down. Friday, the Prime Minister said he's sending 2 field hospitals to the Greater Toronto area. Solomon says that's a Band-Aid solution, and what's really needed is the vaccine. Abigail Bimman, Global News, Ottawa.
An Ontario teen who worked at a long-term care facility has died of COVID-19. Few details are known. For privacy reasons, health authorities will only say the case involved a male, but wouldn't clarify his age or if there were any underlying health issues. We have confirmation tonight the highly contagious UK variant is behind a serious outbreak at an Ontario long-term care centre. Genome sequencing on all 6 samples tested from Roberta Place in Barrie have now been identified as the variant first found in the United Kingdom. 127 residents have contracted the virus, accounting for nearly everyone who lives there. 84 employees have also tested positive. That's half the staff. To date, 32 residents from Roberta Place have died from COVID-19. Ontario is expanding its blitz of big box stores and other essential businesses this weekend. Inspectors will now be paying visits to stores in Ottawa, Windsor, Niagara and Durham regions. Corporations can be fined $1,000 for failing to comply with Ontario's public health orders. The race to vaccinate more Americans against COVID-19 is on. President Joe Biden has set the ambitious goal of 100 million shots in his first 100 days in office. In order to do that, the U.S. will need to ramp up vaccine production and distribution. And as Jennifer Johnson explains, it's also contending with new variants taking hold across the U.S.
In the race to get vaccinated, North Carolina residents lined up around the Charlotte Motor Speedway to get their shots before the supply ran out.
It was seamless. It was amazing. It was well organized.
Across America, vaccination centers are running into roadblocks. At least 15 sites in New York City have been forced to shut down because there are no doses left. Other states and cities are also seeing their supplies quickly dwindle.
I think we have to be realistic with it, that if you aren't over the age of 65 and if you don't have health conditions, it's going to be probably in the summer before it's available.
President Joe Biden is pledging to get 100 million shots administered in 100 days by boosting production through the Defense Production Act and creating federal vaccination centers.
God willing, not only do 100 million, we're going to do more than that.
Biden's team says its biggest challenge is getting more vaccination sites, additional pharmacies, and mobile clinics up and running quickly.
Because if we don't set those up, then we'll be in a place in perhaps a month or so where we're sitting on too much supply at a time when many people want to get the vaccine but can't.
Complicating the battle, new strains of the virus from countries including the UK, Spain, and South Africa that are more aggressive and possibly even more deadly. Old guidelines are changing.
Say it took 10 minutes of a conversation 4 feet apart for me to give enough particles to you to spread the virus. Now that number is half or a third, and so much more transmissible.
As President Biden pushes for all Americans to wear masks, the U.S. COVID-19 death toll continues to mount, expected to hit 500,000 Americans next month. Jennifer Johnson, Global News, Washington.
The Senate impeachment trial for former President Donald Trump will begin next month. Arguments are set to get underway in the Democrat-controlled Senate the week of February 8th. Trump is facing a single charge of incitement of insurrection. He's accused of riling up the mob that stormed the U.S. Capitol earlier this month. Senate leaders reached a deal to delay the proceedings to February to allow Trump's legal team more time to prepare. Trump is the only president in U.S. history to be impeached twice. If he's convicted, he could be disqualified from holding public office ever again. The Trudeau government is standing behind the process used to appoint now former Governor General Julie Payette. Payette resigned as Canada's vice-regal on Thursday. The stunning move followed reports of a scathing independent review into allegations of a toxic work environment under Payette's watch at Rideau Hall. Mercedes Stevenson joins us with more on the government's response to the resignation. Mercedes?
Robin, never before have Canadians seen a Governor General resign in disgrace. The unprecedented move means the Chief Justice of the Supreme Court of Canada will fulfill the Governor General's duties until a replacement is found. Payette's departure is again raising questions about how she got the job in the first place. Prime Minister Trudeau opted to abandon the advisory committee that the Harper government had put in place for vice-regal appointments, a move that in hindsight might now seem ill-advised. But so far, the Trudeau government isn't promising to reinstate that committee. Here's what the Intergovernmental Affairs Minister, Dominic LeBlanc, told me.
We've already had conversations with the officials that typically do this kind of work to ensure that anything going forward, the vetting process is strengthened, is reinforced. We have enormous respect for the women and men who work at Rideau Hall.
Also on the show this week, I'll speak with the U.S. Chargée d'Affaires, Catherine Brucker, on what Ottawa should expect from Joe Biden and his administration. And Alberta Premier Jason Kenney explains why he wants Canada to hit back at the U.S. over President Biden's decision to nix the Keystone XL pipeline. Robin?
Mercedes Stevenson in Ottawa. Thanks, Mercedes. And you can watch the West Block tomorrow, right here on Global. It's election season in Newfoundland and Labrador. The province is going to the polls next month in the latest campaign to take place during the pandemic. 3 other provincial leaders took the same gamble and saw it pay off. But as Ross Lord explains, the Liberals' timing of the election call is raising eyebrows.
In a province where COVID-19 is almost non-existent, public opinion polls suggest the Liberals of Newfoundland and Labrador might use that success to go from a minority government to a majority. Having become Premier automatically after winning the Liberal leadership, Andrew Furey needs a mandate. But Furey has chosen an unusual time for an election, February 13th, the dead of winter.
There's always an excuse not to have an election, but democracy has to proceed, and this is the law. I didn't make the law, but I said from day one, I'm going to follow the law, and I'm following the law now.
By going to the polls now, rather than waiting until spring, Furey has raised suspicions that he's not being totally transparent. Critics like PC leader Ches Crosby say he's trying to snatch victory before the upcoming release of a review into the province's horrid finances, a review that could lead to cuts and job losses. This political analyst says it's a landmine for Furey.
It's never good when you are a political party, a governing party, and you are hiding things. So as long as you're hiding things, the opposition can say there's a wicked, evil, hidden agenda here, and that plays to people's fears. So that's where it's a serious problem for the Liberals. They need to get a handle on that issue.
Furey, a medical doctor, suggests the province needs tough medicine, but he insists fears of the economic review are overblown.
First of all, there is no report. There hasn't been a pen to paper.
So far, premiers who've gone to the polls during the pandemic are glad they did. 3 provincial elections in recent months all favored governing parties. New Brunswick's PC government, led by Blaine Higgs, added 7 seats, turning a fragile minority government into a majority. In BC, John Horgan's New Democrats also went from minority to majority by adding 16 seats. And Scott Moe's Saskatchewan party defended its majority, picking up 2 more seats than it had before the election call.
We put faith in our leaders because we have to, because we're in an emergency situation and we need some sort of guidance.
Newfoundlanders must now decide if they too will place their faith in the incumbent party. Ross Lord, Global News.
More than 3,000 demonstrators have been arrested in Russia, including Alexei Navalny's wife. About 5,000 people packed into Moscow's city center demanding the opposition leader be released. Clashes broke out with police trying to shut down the demonstration. Navalny had called on his supporters to protest his arrest last week. One of Vladimir Putin's biggest critics, Navalny had returned to Russia for the first time since being poisoned with a nerve agent. And one of Navalny's political allies was also arrested while doing a live TV interview. Rallies in support of Navalny erupted in 60 cities across Russia. They say they're undeterred by today's arrest and are vowing to protest again next weekend. So far, the Kremlin has no comment. Coming up, the man who conducted more than 50,000 interviews.
And you're a pro-Canadian guy, right? And
I am.
You're like big for Canada.
Yes, I am.
So one thing, I love Canadians, and you have a great national anthem.
I agree completely.
Much better than ours. Oh, Canada.
Actor Jay Baruchel is one of several Canadians Larry King interviewed over a career that spanned more than half a century. The broadcaster conducted an estimated 50,000 interviews. King died today at the age of 87. His cause of death has not been released, but he was hospitalized earlier this month with COVID-19. He was known for his trademark suspenders and his ability to get elusive guests. Here's a look back at the King of Talk and how he defined conversation.
Do you pinch yourself saying, come on, you're one of the most powerful women in the world?
Larry King was a broadcasting legend.
Detroit, hello.
For more than 60 years, his unique interviewing style brought celebrities and newsmakers into millions of homes.
How did you emotionally hold up through all that? Well, I'm here. I know, but how? What is it? Is
From presidents?
I don't know. As a matter of fact, I've never been in the Watergate.
Never been in the hotel? Never
been in the hotel, never been in the restaurant.
To A-list entertainers.
Frank Sinatra. That's still a kick.
Absolutely.
Got a date with an angel.
King knew how to get people to open up.
Hi, get me out of here.
And America loved it. For 25 years, starting in 1985, he hosted CNN's Larry King Live. At his peak, King's show reached more than 1 million people each night.
I want to be surprised every night. The best shows for me is when I go, yeah, wow.
In 1993, a debate over the North American Free Trade Agreement between Vice President Al Gore and Ross Perot was watched by 11 million people. At the time, a record for cable television. Born Larry Ziegler, King changed his name when he began his radio career in the 1950s. He survived a heart attack in 1987 and was married 8 times to 7 different women. After stepping down from Larry King Live in 2010, King had second thoughts about retirement and took his show to the internet, debuting Larry King Now in 2012.
I love asking questions. I'm very much into people, and you never lose that.
Larry King, a radio and television icon. He asked the questions Americans wanted to ask. Dan Sheneman, NBC News.
Still ahead, the revolutionary technology, decades in the making, that is so crucial to COVID-19 vaccines.
You're watching Global National.
On this day last year, 11 million people in Wuhan, China entered the world's first COVID-19 lockdown. Those long 76 days were key to keeping the virus in check. No cases have been reported there since May, and life has mostly returned to normal. But in Hong Kong, an outbreak of COVID-19 has triggered the city's first ever lockdown. The order covers the neighborhood of Jordan in Kowloon Peninsula. Thousands of people must stay home for 48 hours, and every resident in that zone will be tested for the virus. The 2 vaccines approved for use in Canada have a fascinating backstory. They use a genetic technology scientists have been working on for years. It's called messenger RNA, or mRNA. They knew it held promise, and when COVID-19 hit, they ramped up research and cracked the code. The results are the first mRNA vaccines approved for use in humans. And as Donna Friesen explains, the technology could revolutionize the field of vaccines.
Zara Kahia spends her days caring for the vulnerable. She's a respiratory therapist in the chronic ventilator unit at Capital Care Norwood in Edmonton.
They have compromised respiratory systems and they require 24-hour respiratory support.
When she heard the Pfizer-BioNTech and Moderna vaccines were approved, she had questions.
I'm a numbers girl, so I tended to kind of read the studies, and that kind of made me feel more confident in taking this vaccine.
They are mRNA vaccines, technology that is revolutionary but not entirely new. Scientists have been working on it for decades.
It's a very precise and elegant way of telling our immune system to respond against the virus.
This, in simple terms, is how mRNA vaccines work. The coronavirus's spike protein, which forms its crown, is what makes it so infectious. mRNA vaccines work by using that weapon against the virus itself. Like a computer code, synthetic mRNA tells the cells of the body how to make the spike protein. Scientists had to find a way to inject it without having the immune system immediately attack it. They came up with a lipid nanoparticle, a kind of invisibility cloak, a fatty bubble that encapsulates the mRNA and keeps it from being destroyed, allowing it to slip into the cell. Once inside, the mRNA is released, and the cell starts building the spike protein, mimicking a COVID-19 infection. It is completely harmless, but it triggers the immune system into creating antibodies against the coronavirus. It is a breakthrough that's advanced work already underway on other vaccines and treatment for other diseases, including cancer. Kahia was the first person in Alberta to get the COVID vaccine.
The first question is, are you okay? And then the second question is, should I get this vaccine? And I always answer with yes.
Donna Friesen, Global News.
To learn more about how the COVID-19 mRNA vaccines work, watch Donna's entire story tonight on The New Reality, right here on Global. Value Village Riches. Up next, what employees did when they found a treasure at a secondhand store. This next story begs the question, what would you do if this happened to you? Employees at a Vancouver thrift store were sorting through donation bags when they came across a hidden treasure. $85,000 in cash. And as Nadia Stewart reports, it's what happened next that has everyone talking.
It is the place where people go to get more bang for their buck. Thrifty deals without breaking the bank. But what staff found when sorting through donations this week was an unusual find, to say the least.
Holy smokes, this is a lot of money.
Jeffrey Stonehouse manages a Value Village in Vancouver. Days ago, he and another staffer were sorting through a pile of donations when they came across a bag that was full of surprises.
The bag was a little unusual. It felt like documents. And so she pulled out the first envelope and tore the top off of it and pointed it in my direction. And what we saw was a lot of $50s and $100 bills.
I don't know how old this money is. I can tell you that the money had been stowed away for quite some time.
Stonehouse says even police were taken aback by the amount, over $85,000. The cash was in a bag, a dollar store bag no less, and it contained ID that helped police identify the elderly woman whose cash this was.
As it turns out, there's an elderly woman. She's now living in a care home. She's been in the care home for about a year. And her family was going through some old storage lockers that she had, and they found some bags of stuff. They decided to donate the bags to Value Village, not obviously knowing what was in it, and never knowing that this money even existed.
The money is now on its way back to the family, with police praising Value Village staff along the way.
They did the right thing. They called the police.
Stonehouse says what he and his staff did was what they always do when receiving something they feel was not intended for them.
Usually it's when we get a call from somebody, they've misdonated something. It's usually like my wedding dress or my grad photos or something like that. But this certainly was outstanding.
This was an unintended donation they won't soon forget. Nadia Stewart, Global News, Vancouver.
And that is Global National for this Saturday. I'm Robin Gill. Tonight, your Canada is the hamlet of Beaver Creek, Saskatchewan. Thank you for watching, and I'll see you back here tomorrow. Have a great night.